people and Mr. Bobo, who is head of PRO. Just got this information about 10 minutes ago that you are on your way to this place. So you are aware. This accident. This building, yes. I just wanted to mention that building that is okay, that building is a new building that is almost about 70% completed. It's an NDDC project, October, November last year. And it's going to be our next building for orthopedic surgery inpatients. And the reason for this is because this axis of the south-south, we have the Benin-Onitsha Expressway, and it's plagued with recurrent accidents. And most of the victims come to this hospital immediately after the crash. And so we needed a place that will afford us to be able to cater for them when they come. And so we approached the NDDC, and they willingly decided to build this structure for us. It's going to be able to cater for between 60 and 70 inpatients at any given point in time. So we are hoping that this project will be handed over to us within the next 3 months. That means 3 operations can be going on simultaneously at the same time. And we also have facility for, the part of the facility there is that the oxygen that is utilized in there is piped in theater. And then we have 3 consultant anesthesiologists. We have close to 8 consultant surgeons, and then 7 O&G doctors who also do various kind of operation. And we also have an ophthalmology department, and we also have surgeons who do various eye surgery there. We also have capacity to do what you call endoscopic prostatic surgeries. So we can do quite a lot here, even though we are still expanding orthopedic surgery ward, which can cater for about 70 patients at a time. We also have the outpatient complex, which is going to take care of accident victims, both. Yes, that complex is going to take care of accident victims, and in addition to having facilities for children emergency. That facility alone can also cater for admission capacity of about 60 at a time when completed. And the gigantic project is being funded from the Federation account under the capital project for this hospital.
You have IGR?
Well, we run IGR system, which is all revolving.
How much is your internally generated revenue?
Now, currently we are able to generate close to about 30 million a month.
Okay, Honourable Minister, I must, on behalf of the government and people of Delta State, commend the federal government over this hospital. I'm saying so because I know the history of this hospital. It's a very old hospital, built by the Delta State government in those days. When I came in as Commissioner for Health in 1999, the federal government had taken over from the states. The federal government had taken it over from the state government as a federal medical center Some of us argued then that they should leave it for the states and let the Federal Medical Center be sited in a new place. But our arguments were not taken, and it was left at Federal Medical Center. And for a long time, nothing new was done in the hospital. I think maybe one of the new things that was done for so many years was the maternity wards. But I can say that with this administration, you can see that this theater is in place. It was commissioned in January. With this administration, you can see that an accident and emergency center is being built. With this administration, you can see that an orthopedic center is being built. And these are major achievements of this administration in this very short period. And I want to commend the federal government, and I want to say through you, thank Mr. President for the expansion work that's going on in this hospital. I know the other challenge they had, because they say that a lot of work to be done, is that of land. Last time the Minister of Health came, he requested for land somewhere else, because the place is already choked up. You can see that it's already choked up. And we're trying to provide another parcel of land. Once we're able to do that, I know a lot more development of the hospital will pop up. So we want to thank you on behalf of the people of Delta State for the expansion work going on in this hospital, because at the end of the day, it is Deltas really that will benefit from it.
Your Excellency, Governor of Delta State, distinguished ladies and gentlemen, let me also appreciate the support that you have given this hospital, giving them, first of all, the former hospital, which was stayed on, and you handed over to the federal government. You're a medical doctor yourself and have been a commissioner for health here and now governor, so you understand the implications of health for the good of your people. The federal government is doing a lot in health across the country, and we've been visiting different medical facilities which the federal government has been putting in place. The teaching hospitals are changing completely. In a number of them, we're virtually reconstructing them. Benin, Jos, Calabar, several. We saw the one at Abakaliki, a very big hospital that we are constructing there. But the most important thing is the facilities that the federal government is supplying. Most of the theaters are now very modern. You can do keyhole operations. You can do all those surgeries that were used to be seen only abroad. We're now having the facilities to do them in Nigeria. We're also setting up cancer screening centers. Is this place one of them? Yeah, there's also a cancer screening center now. And this screening, we have 6 zonal centers which we're establishing for optimal health support. Trauma centers also being established to deal with accident cases, with trauma, natural disasters, and so on. So in health really is very comprehensive. And Professor Chukwu has been doing a lot since he became Minister of Health. He himself, being a professor of medicine, it's made it easier for him to intervene where he needs to intervene. So I want to thank you. A lot of these things will be seen in other places as we go around. But I want to thank the state government because there's a synergy. When you have a synergy between the state government and the federal government, the results are better. And I appreciate the comment you are making here, that whatever the federal government does in any state, we don't have any citizens. They were doing it for the people of that state. So we appreciate what you are doing, CMD and the staff of this hospital. Please, as these facilities come, let's ensure proper management, proper maintenance of the equipment, and so that our people don't have to go abroad. We go out of Nigeria, it's Nigerians that operate us, and we pay 3-4 times what we pay in Nigeria. So now that these facilities are coming, we hope our diaspora will come home, and then we can transform our medical facilities. Thank you very much.